So when you need to insert a nasogastric feeding tube with Enfit connection, you're going to grab the packaging for the nasogastric feeding tube, and you also need to grab your syringe with the Enfit connection. Okay. First thing that you're going to need to do is obviously tell your patient about the procedure. You're going to need to measure. Okay. When you're measuring, you're going to measure from the tip of the nose of the patient to the ear, tragus, down to the xiphoid process, and then you're going to go another 10 inches or 25 centimeters to measure to get to where the length of where the intestine would be. After that, if you've done the measuring and you know where you're going to be, which is in centimeters on the black hash marks on the tubing, then you're going to take your connection from the Enfit syringe. You're going to want to draw up sterile saline in the syringe. You're going to take the end of the syringe, you're going to connect it to the tube feeding. Okay, you need to inject 10 cc's of sterile water into the tube. Then, after you've injected the 10 cc's, because that's going to activate the hydromer coating, you have to take the tip, you need to put another bit of water and submerge it into the water on the tip before you can insert into the patient. Next, you're going to insert into the patient and make sure the patient is in the high Fowler's position. You would lubricate the end of your tubing. Tell the patient to continue to swallow, keep swallowing, keep swallowing. Once you have the tube feeding in place, you're going to need to inject another 10 cc's of saline to make sure that it's fully activated. After you've injected the 10 cc's of saline, you can now tape the tubing to secure it in place and get your x-ray to confirm placement, and you can also listen with your puff of air if you choose to do so.